Imagine that you went along to see your doctor about something that was concerning you, and they said, "Yes, I think we can help you with what's troubling you." How would you like us to do that? Would you like one session next week? Or would you like to wait a few months and have 10 sessions? Or would you like to have a session a week over the next 5 years? And you might say, well, is there much difference in outcome? And if they replied, well, no, not really, not a lot, you might say, well, this is an easy choice. I'll have one session next week. Thank you very much. Well, this is the position we are in when we are wondering about single session therapy for our clients. These are the options we can offer them. And so you can see the appeal of single session therapy for our clients and indeed for us. It is wonderful the therapeutic approaches we have now available to us. CBT, DBT, ACT, compassion-focused therapy, motivational interviewing, solution-focused therapy, and so on. We have some wonderful knowledge and skills available to us. So the question that confronts us now is, what is the best way of delivering that knowledge and skill? And for me, single session therapy is very powerful. It has some clear advantages over multi-session therapy. For instance, imagine if you had had 10 or 20 sessions of therapy. You were a client and you'd had 10 or 20 sessions of therapy, and you found yourself maybe improved, but not really as improved as you wanted to be, or you found that you relapsed after a few weeks or months. Potentially you could be very disappointed and quite short of hope for the future. You'd say to yourself, well, I've had 10 or 20 sessions of therapy and I'm not really that much better. What hope is there for me? And you might contrast that with a client who's had one session and found that they'd improved because they're acting on the best single idea or best couple of ideas that they'd agreed with the therapist. And that they knew they could maybe go back and have another single session in a few months or a year or two if they needed to. That would be different, wouldn't it? And what about the therapist? When they have delivered all those sessions and the client returns to say they have relapsed or not really improved sufficiently, that's not good for the therapist either, is it? And you see that the client, would have much more hope for the future. And for many people, the degree of hope they have for the future is a key element. So for me, the way in which we deliver the knowledge and skills we have is an important factor to address. And I find single session therapy very, very attractive, both from the point of view of the client and from our own point of view, and from the point of view of general efficiency, of helping as many people as we possibly can do, and feeling just as committed to the people on the waiting list as the people we're actually talking to in the clinic. So there we are. That's what this course is all about. It starts with the idea that single session therapy is a very important concept, and it shows us how to deliver single session therapy just as well as it possibly can be delivered, which is very well indeed.